All right, good morning, good afternoon. My name is Allison Moran. I work at the World Health Organization in Geneva, and I'm here presenting with my colleague, Dr. Florina Surbanescu for the Centers for Disease Control and Prevention in Atlanta, Georgia. And we are here to give a guest presentation today on monitoring maternal and perinatal death surveillance and response. So during the presentation, we're going to first talk a little bit about some background information and present the monitoring framework that we've been developing for maternal perinatal death surveillance and response. And then we'll discuss two potential indicators and some of the next steps for moving forward. So I'm going to present the background information and the overall monitoring framework. And then Florina will talk about the two MPDSR indicators that we've been working on, as well as some next steps. So just for a little background, we know that there's still quite a large burden for maternal and perinatal mortality globally. In 2017, almost 300,000 maternal deaths were recorded, about 2.5 million newborn deaths in 2018, and the latest estimates on stillbirths have about 2.6 million stillbirths globally. The largest burden of deaths is in sub-Saharan Africa, and we know that half of the stillbirths occurred during labor and birth, mostly from preventable causes in low and middle income countries. So in order for us to really address these mortality issues and the unnecessary deaths, we need to have better information about the deaths and what caused them. So we need more information to plan appropriate actions, such as who died, where did they die, when did they die, why they died, and what could be done to prevent similar deaths. So the process of maternal and perinatal death surveillance and response tries to address some of these questions to provide more information on different types of mortality. MPDSR is a continuous cycle for identification, notification, and review of maternal and perinatal deaths, followed by interpretation of the findings, response, and action to prevent future similar deaths. MPDSR operates at all levels of the health system with an aim to ensure accurate documentation and reporting, identify modifiable systemic and social factors at different levels, and then really importantly, link recommendations to actions and accountability for follow-up. So over the past several years, the World Health Organization, in collaboration with the global MPDSR Technical Working Group that includes UNFPA, UNICEF, CDC, and many other partners, has worked to develop a variety of different tools and resources to roll out MPDSR. In 2012, the ICD application for deaths during pregnancy, childbirth, and perineum was released, ICD-MM. And then in 2016, a similar document was released for perinatal deaths, ICD-PM, which is how to look at and code perinatal deaths. In 2017, there was technical guidance released on maternal death surveillance and response. And 2016, technical guidance on audits for stillbirths and neonatal deaths. The Making Every Baby Count guide was finalized. In 2016, the Global Working Group and other partners put together a survey and baseline report called Time to Respond, which looked at the status of the implementation of MDSR and perinatal audit across various countries. And the working group is now working on materials to support an implementation of MPDSR, including improving the quality of the reviews and the tracking of implementation of recommendations. So we know, though, that the monitoring of how MPDSR is rolled out is really crucial. And so the MPDSR Technical Working Group has developed a draft monitoring framework that consists of 5 different components, looking at measures that can be assessed at health facility, district, regional, and national level. And these indicators for the first 3 components listed on the slide are included in a catalog of indicators. And it's anticipated that not all countries would monitor all indicators at each of these levels, but that specific indicators would be selected depending on the relevant context and information systems. The 4th component is a list of common measures, which we would hope that all countries could try to collect so that we have a common set of standardized indicators across countries to better understand how MPDSR is being rolled out across various countries. And then finally, the monitoring framework outlines additional indicators that require further testing and research, most notably to better understand the quality of the death reviews and the implementation of recommendations. So just to give a quick note on what the MPDSR common indicators that are included in the guidance are, we have 6 indicators at the impact level, looking mostly at mortality and causes of death. At the outcome level, we're looking at the proportion of deaths that were notified and the proportion of deaths that were reviewed. And then at the output level, we have 4 different indicators to try to understand how the systems are being implemented. So looking at functional national MPDSR committees, functional committees at district or regional levels, countries that complete annual reports, and the proportion of recommendations that are implemented. So now I'm going to turn it over to Florina, who's going to talk a little bit about the experience we've had looking at the outcome level indicators that are denoted by the red arrow.
Thank you, Alison, and good morning, good afternoon, everyone. My name is Florina Cervenescu, and I am an epidemiologist at CDC in the Division of Reproductive Health. So as we seen, how well a surveillance system functions must be monitored and evaluated periodically in order to accomplish the goals that Alison had mentioned. We have seen that 2 standard indicators had been proposed to monitor notification and review rates. In the next couple of slides, we'll define these indicators and use the only source currently available for country comparisons of these indicators. This is a survey that is conducted annually by UNFPA and is collecting data from ministries of health, UN agencies, and national maternal mortality surveillance committees from 32 countries. The countries are listed on this slide. And it's worth noting that the support for this activity is coming from the Newborn Health Thematic Fund that supported surveys starting with 2015. Next slide. Could we move the slide?
Next slide.
Yes.
Is it?
No, it doesn't. Oh, sorry. Yes. So how? So the proposed notification rate indicator is defined as the proportion of maternal deaths notified in a year out of the expected maternal deaths that occurred in the same year in the country. Both notified and expected maternal deaths are including facility and community maternal deaths. As many low and middle income countries do not have annual complete estimates of maternal deaths, usually lacking accurate reports on community level deaths, we proposed using expected number of deaths published by the Maternal Mortality Estimation Interagency Group. These figures are published every 3 to 5 years with accompanying annual percentage change that will allow using rigorous and comparable estimates in all countries where notification rates will be calculated. Ideally, we would like this indicator to be 100% because all maternal deaths must be notified and all maternal deaths need to be accounted for. Next. So here we see results of the 2017 UNFPA survey conducted in 32 high-burden countries. You see notification rates ranging from 0 to over 40%. It is worth noting that 28 out of 32 countries have less than 40% notification, and 20% have less than 20% notification. Next. So maternal death review rate is the second indicator that we propose for global monitoring, is representing the proportion of maternal deaths reviewed and reported at a central level out of all expected maternal deaths. Similar to the notification rate, we propose using the same source for the denominator, the estimation of interagency maternal mortality group. This indicator is also recommended to be 100%. However, taking into account that most countries only review deaths that occurred in health facilities, that's going to be, for the moment, hard to attain. We recognize that 100% is aspirational, but we like to recommend that at least all maternal deaths that occur in health facilities have been reviewed. Next. The next steps for our collaboration between UNFPA, WHO, and CDC is to encourage countries to adopt these indicators, as they are easy to collect. They can be analyzed and programmed at the country level. They can be collected through HMIS systems too. They definitely give some direction in supporting maternal death surveillance and response implementation. And in the long run, they will improve quality of data on maternal death. We are conducting analysis of the data collected by UNFPA for several years of surveys, and we are in process of issuing some results and interpretation with future direction. One important note is that the two indicators that we presented here have been already adopted by the Campaign on Accelerated Reduction on Maternal Mortality in Africa, or CARMA. CARMA has been launched by the African Union in 2009. Its mandate is that no woman should die while giving life. The campaign is mobilizing political commitment and action to reduce maternal mortality in countries with high rates. And very recently, the African Health Stats Maps, which is a tool to visualization, have been added to CARMA platform. This will add more countries with data about notification and review rates very soon. So we are looking forward to utilize this additional data source. Our future directions are going to focus on defining and testing indicators that are capturing better quality of the reviews and the responses. We recognize is a great need for these indicators, because just saying that we perform a review is not enough if it's not followed by action. So we conclude our presentation, thanking you for your interest in monitoring MDSR, reminding you that there are additional resources, the publications that Alison has shown, and we are welcoming your feedback and your suggestion to strengthen monitoring of MDSR. Thank you.
Thank you.